Behind me, a patient is fighting for her life. Cholera is not a disease that belongs to 2025, yet here in Aguna West, it has stolen lives. The people here are not just suffering, they are dying for something as basic as good sanitation.
Fidelia Al-Hassan, not her real name, is pregnant and battling cholera.
I didn't know that it was cholera until I get here. It was just my stomach and I was running too. I am pregnant, so I went to the ANC. Then they told me to go to the emergency first.
How many months pregnant are you?
Let's say 23 weeks. Because of work, so I normally buy foods outside. So maybe it could be that one.
But she's not alone. The Aguna West municipality is in the grips of a deadly cholera outbreak. Over 250 suspected cases have been recorded in the past month, with 3 deaths. For Eunice Benyi, January 19, 2025 is a day she will never forget. Her sons, Emmanuel and Ebenezer, were full of life, but in just 24 hours, cholera took them both.
Gets one. No toilets. No, in a pain, so no, off, but no on toilets.
My children both had diarrhea, and the little one was also vomiting. Just as we were about to sleep, one of them kept asking to urinate and had a severe running stomach. By morning, my eldest had passed away at home. We rushed the little one to the hospital unconscious, but the doctors couldn't find his veins to administer treatment. He too didn't survive.
Well, Nakaton on question and soon call. May I specific? Well, shouldn't know none so firm.
Doctors at the Aguna Swedro Municipal Hospital confirmed their deaths were caused by cholera. But the nightmare is not over. Eunice's last surviving child is also fighting the infection, and she's afraid she might lose him too, despite being treated and discharged from the hospital. Yvonne Benyi, who shares a compound with Eunice, says 5 children in their household, including her own, have contracted the disease.
My son had diarrhea and was vomiting, so I quickly rushed him to the government hospital where he was being treated.
I am heading to Nkum, a community about a 40-minute drive from Swedro in Aguna West, where the cholera outbreak is also taking its toll. Access to potable water remains a major challenge here, with most residents relying on untreated stream water for survival.
This is just one of the main streams that connects at a point where residents here in Nkum would come and fetch water for their menial activities. Clearly, you can tell the water is unsafe, it is untreated, but this is what residents here in Nkum depend on for survival.
We drink this water. My parents use it for cooking and even take some to the farm to quench their thirst.
We use this for bathing, drinking and washing.
A heap of refuse sits dangerously close to the streams, while open defecation is rampant, further worsening the situation. This is a breeding ground for cholera, and the community is paying the price. 2 people have already died here, and more are falling sick by the day. Environmental health officer and member of the rapid response team working with the Ghana Health Service, Mark Jojoji, has been working tirelessly with his team to contain the outbreak.
We intensify our hygiene education activities. We go from churches to schools to public gathering places to educate them on the surge of the cholera. And so we educate them on all preventive measures.
The cholera outbreak has intensified fear among residents, but the Deputy Director of Public Health for the Central Region continues to implement measures to curb its spread.
Since the beginning of cases being suspected in Agna West District, the highest number we've had in a particular day was on the 4th of January 2025. That was 22. Averagely, we've been having sometimes 15, 7, 6, 5. So I would say that averagely we do like 7 or 8 cases per day. Currently, the past 3 days, the numbers have been encouraging, meaning that they are going down. So as at close of work yesterday, we had 5 cases.
As of December 26, 2024, the cholera outbreak in parts of the country had claimed 37 lives, with confirmed cases rising from 346 to 359. The number of affected districts also increased from 44 to 46 as of December 24, 2024. Cases emerged in Aguna East and La Nkwantanang Medina in the Greater Accra region. While hospitalizations have decreased from 64 to 48 within the reporting period, the Western region remains the hardest hit, with 37 people currently receiving treatment.
For years, authorities have promised improved sanitation, safer drinking water, and better health care. But those promises remain words on paper while people are buried in shallow graves. The people of Aguna West are not asking for luxury. They are begging for survival, and if help does not come now, more will die tomorrow.
Godwin Asediba, TV3.